So my name's Penny Burns, and I'm very honoured today to receive the Rose Hunt Award. When I was phoned a couple of weeks ago by the RACGP President, Karen Price, I presumed it was due to some sort of disaster issue and there's some sort of emergency. And I was absolutely not expecting to be told that I'd won this award with Dr. Cameron Loy. This is a particularly important time for me to receive this award during these catastrophic years that we've had. We've had 2 years of disasters just rolling out. We've had bushfires, floods, hailstorms, drought, heat waves. And I'm very humbled to be receiving this when there are so many other people that also deserve it. And I think GPs have been on call again and again and again throughout all of these events and over the last decade since I've been involved in disasters. And each time they have stepped up, they've adapted, they've innovated, they've been incredibly creative during this pandemic. And we know now that GPs are a trusted, safe place that people go to. They flood to waiting rooms in disasters looking for that safe healthcare professional. And I think every GP has supported their community through this pandemic, and I think every Australian GP deserves this award. And so I'd like to share this with all Australian GPs. And I guess it's not just the GP teams that have worked through all this time, it's also been all those other people supporting GPs, including the RACGP staff. And we could not have accomplished so much if we didn't have them working alongside and supporting. And I know that I've been part of a COVID working group that's met every week with a whole lot of staff to look at issues and deal with issues as they arose. I think that we've sort of come a long way in disasters. And I know in rural areas they've always been, or those affected by disasters themselves, but as a general group, we haven't been as interested. And I think it's really good now to see how keen we are to get involved. And also, I'm very pleased that a lot of other non-GP groups in the disaster field are really taking up the call with GPs getting involved. We've come a huge way. We've now finally got some involvement in planning. And my aim is to hopefully push this further. I would love to see GPs permanently embedded in planning at national, state and local level. At the moment, I'm in the final throes of my PhD on GPs' roles in disasters, and so I'm hoping to finalise that. And I guess one of the things I would say, and I've said this many times, and I think people get sick of me saying this through the pandemic and through disasters, is that GPs have been very invisible, and when you go to the research and the literature, there's very little documentation of what GPs have been doing. So GPs don't exist. We don't have the cred. And I think we need to all write up our stories. We need to get them out there. We need to document them. And then I'm hoping that in the future, disaster healthcare management will not only include GPs, but it will actually become much more patient-centric, and we'll have the GPs walking with the patients through the disasters. So I'd like to thank everyone very much for this award, and I'd like to accept it on behalf of all GPs involved in disasters. Thank you.